to you.
Thank you very much, David. Could you just confirm my slides have gone up on the screen for everybody?
Yes, I can see them.
That's lovely. Thank you very much. Well, good morning, everybody. It's great to be here. Great to see so many people on the call. As Dave just said, I'm Kat McMillan. I'm Head of Community Engagement at BCP Council, and I'm going to give you an overview of volunteering that took place in Bournemouth, Christchurch and Poole during the pandemic, and giving you some examples of what we did to try and overcome digital exclusion to support lonely and isolated residents during the pandemic. So hopefully some of you will recognise this symbol. This is the Together We Can logo, and Together We Can, or TWC as we call it for short, was developed at the start of the pandemic as a multi-agency partnership to respond to the pandemic within BCP. The partnership included representations from statutory agencies such as health, police, along with a wide range of partners within the community and voluntary sector. And these, for example, were people that you'll be well aware of, such as Citizens Advice, Community Action Network, Prama, Dorset Race Equality Council, FaithWorks, and many, many more. I can't ever mention every single partner that we work with because everyone's been incredible. TWC still actually operates today. Unlike many local authorities, we still continue to operate that response to the pandemic, and it's merged from what was initially a twice daily meeting looking at stepping up all the things we needed to do to support our residents, through to a monthly steering group partnership meeting, which now looks at how do we respond to the impact of the pandemic and that longer term recovery that we need around things like financial resilience, debt, and sort of the health and emotional well-being that's emerged as a result of the pandemic. So let's go back 2 years. And I don't know if anyone ever wants to live through this again, but I'm sorry, I'm going to put you through the pain. So this is what happened nationally. So on the 31st of January 2020, we had the first 2 confirmed cases of COVID in the UK. On the 8th of March, we had 273 confirmed cases, and unfortunately, we reported 3 deaths. On the 9th of March, the first 3 cases were confirmed in Dorset. And on the 12th of March, the government advises that anyone with a new continuous cough or fever should self-isolate for 7 days. On the 15th of March, the Health Secretary says that every UK resident over the age of 70 will be told within the coming weeks to self-isolate for a very long time, or to shield, as we ended up calling it, from the coronavirus. And then it got really serious. The 16th of March, the Prime Minister advises everyone in the UK against non-essential travel and contact with others, to work from home if possible, and to avoid visiting social venues such as pubs, clubs or theatres. On the 20th of March, my worst nightmare was confirmed. The schools were closed, except for key worker children, and we were expected to homeschool. And on the 26th of March, a full lockdown comes into effect, something that none of us, I think, have ever experienced before. What happened locally in Bournemouth, Christchurch and Poole? So on the 23rd of March, we were instructed by the government to set up a helpline which operates 8 AM to 8 PM 7 days a week to support anybody who has needs as a result of the pandemic. On the 23rd of March, with our partners CAN, Community Action Network, we put out a call for volunteers because we thought we're going to need a lot of help with this. And within 3 days, we had 282 volunteers signed up to support vulnerable people in BCP. We rapidly developed a triage system, expecting lots of calls to come into the helpline. And unlike Dorset, we didn't have a volunteer centre that was able to man and deploy volunteers directly. 2 years down the line, we have an incredible volunteer hub that's operated by CAN. Just looking at the mass vaccination sites alone, they've donated over 90,000 volunteer hours as a result of the work there. But we didn't have that at that point in time. So we had to look at developing role profiles for volunteers, looking at how we deploy them safely, all of the things that you need around, okay, well, if they're going to do shopping for someone, what do we need to do about payment? How does that work? If they're shielding at their home, they might not have money. All of these little bits and pieces that we'd never anticipated had to be worked through and developed. We had to develop an identification badge because everyone's been told not to drive around. So if we're sending volunteers driving around the county, please tell me they're not going to get fined by the police if they're stopped. So we had to find a way of making sure that they were identifiable to our police and partners. And on the 27th of March at 4 PM, the Together We Can helpline was launched and the website was live with supporting information. On the 30th of March, we began Operation Shield, and this was a requirement for us to contact every single person that had been recognised as shielding a clinically extremely vulnerable resident within BCP. There were 30,000 of those residents alone within Bournemouth, Christchurch and Poole. And as I'm sure you can imagine, that's a significant amount of work trying to make contact with every single one of those people, many of whom didn't understand why they'd been classified as clinically vulnerable. It's not easy to say, that's why we say CVs, clinically extremely vulnerable. And it wasn't just elderly people, this was a wide range of people. There were children, there were people who were suffering from cancer, already going through very, very difficult times. So to have phone calls from the council checking that they're okay, for some was absolutely brilliant. It was a real reassurance, but for others, they just had a lot of questions. Why me? What's wrong? Why can't I go out? When will I be able to go out? So we actually ended up deploying initially 40 staff from within the council to man those phone lines and to make those calls. As we moved on, that rapidly increased to 200 people redeployed within the council to make those phone calls. And at the height of the pandemic, we had 400 council staff that were redeployed to those phone lines to make contact with individuals. On the 8th of April, we established dedicated work streams for access to food, and this was looking at making sure that people were able to get to food if they didn't have it. Many people had lost their jobs, were furloughed, weren't able to leave their homes. So we did a lot of work working with our colleagues in economic development around, okay, well, what food businesses have we got out there that could deliver food that you could order online? You could order on the phone if you didn't have the internet, and making sure that that was a viable option for people within the community. We had a dedicated work stream around volunteering and communication, so making sure our messaging is getting out to people so that they know where to go if they need help. We had a work stream around business support. We were swamped with businesses contacting us saying, what can we do to help? I've got vans, I've got people, what is it you need? And through that network, we were able to get donations of PPE. As I'm sure you remember, at the start of the pandemic, PPE was very hard to come by. We got a lot of offers of food. So there were a lot of businesses such as restaurants, hotels that had to close very, very quickly and had huge food supplies. So through the Access to Food Partnership, working with the business support work stream, we were able to funnel those offers of food directly to food settings like community fridges and food banks, and make sure that that food was redistributed back through those food networks. And we had a community development work stream looking at making sure we had a wide range of activities that people could do when they're at home so they didn't go stir crazy. Lots of different things around arts, things to do around homeschooling with your children, but also looking at making sure that and I personally do not like this phrase, but you'll recognise it as the hard to reach communities. How do we engage with those communities that don't often come forward, make sure that they're getting the support? Are we getting our messaging out to them to make sure they know where they can go if they need help? On the 16th of April, we established the financial resilience work stream as we suddenly realised the sheer scale of people who were being made unemployed, losing their jobs, particularly in the hospitality industry, people who probably have never been in that sort of financial crisis before. And whilst many of us who work in this particular area know to go and contact organisations like Citizens Advice to get help with your debts and to manage your budgets, you have a lot of people who just didn't understand where they needed to go to get that support. So it's about making sure that information was out there and readily available to people. And that call out for volunteers. Within 3 weeks, we had over 2,800 volunteers signed up to help, which is absolutely staggering, but just shows you the strength of our communities within Bournemouth, Christchurch and Poole. And now, 2 years on, we've had over 27,000 calls to the Together We Can helpline, and we have redeployed over 5,800 volunteers to support people within our community. And it has to be said that one of those volunteer deployments may actually be, and some still are, a weekly shop for an individual. And many volunteers were volunteering for a number of people within their community. So saying that it was 5,800 volunteers doesn't actually give you an idea of the sheer scale of what took place. Now, I just want to start off by recognising that what I'm going to talk to you about here is the work that we did through Together We Can. There was, as everybody knows, and Matt's referred to it already, there was a huge spontaneous volunteering act that took place organically within communities. Neighbours knocking on door, street WhatsApp groups were set up to support people. All of that happened without us as the council trying to meddle in it and control it and get involved in it. It was a truly staggering response. But I'm not going to focus on that because I'm going to talk to you about what we did in that Together We Can partnership. So with Community Action Network, we established a volunteer hub. We developed, as I've already mentioned, those roles, the IDs and the guidelines about what we should and what we shouldn't do, making sure that we're keeping volunteers safe and the people that they're helping safe. Through that helpline and those redeployed staff, we matched volunteers to vulnerable residents to help with things like shopping or giving them a phone call if they were feeling lonely and isolated, walking their dogs. It could be anything and everything, really, just to make sure that people were supported through those difficult times. We had a weekly email to volunteers to update them on what was happening, give them more information about emerging trends or issues, but particularly just to make sure that they felt like they were being engaged with. And as Matt touched on earlier, we didn't need 2,800 volunteers because the community were a community and they helped each other's. And suddenly we were getting a lot of calls from volunteers saying, why haven't you called me yet? I signed up 2 weeks ago. Why haven't you deployed me? I'm here to help. Why aren't you using me? And so we looked at how we could utilise those volunteers for other roles that were needed. So I'm sure many of you remember that as we came out of lockdown, our beaches were pretty flooded with people coming to fantastic Bournemouth, Christchurch and Poole and Dorset to sit on our lovely beaches. But unfortunately, that came with a lot of litter and a lot of mess. And we were in a very difficult situation in terms of trying to respond to that as a council and keep it clean. So bearing in mind that equally we wanted to recognise the climate emergency situation, we looked at which volunteers we had registered that lived near beach locations, and then we worked with them around establishing beach cleaning volunteer sessions so that they could go and help out in a different way. And as many of us have been sat home in lockdown, whether that was working or furlough or whatever we were doing, I think a lot of us cleared out our garages and our lofts, and we had a lot of stuff that we wanted to take to the tip sites when they reopened. So we also worked with the volunteers that lived around those tip sites, and the Army actually helped with this one as well, to look at how we could bring in volunteer marshals to help with the reopening of those sites when that took place. And a lot of that was just about, you know, the queues of cars that were stacked up trying to get into those sites, just letting them know, look, there's about 10 cars in front of you, you've probably got about a 20-minute wait, you might want to come back after 4 o'clock when it's usually a bit quieter, just to try and help in a different way. Other things that the volunteers got involved in, things you'll probably never hear about. So they made ear defenders for nurses at the hospital for wearing the masks where they're rubbing on the back of the ears. They helped with queues at GP surgery. So as GP surgeries moved from the digital consultation through to reopening the doors, again, needing to maintain that social distancing. So volunteers helped with, very much as at the tip site, marshalling and making sure people were staying to their little circle on the floor, maintaining the social distancing, handing out the hand gel, all of that sort of good practice to try and reduce the transmission of the coronavirus. Also, volunteers were contacted to see if they would like to be linked up with local community and voluntary sector organisations that were nearby. So, for example, volunteers in West Howe were linked up with West Howe Community Enterprises to look at what support was needed in that local community. And I don't know if you remember what we call the Boris boxes. So when government announced the shielding group, as it were, they were all asked to go online and say whether they needed support with access to food. And those that said they did were then sent a weekly Boris box, which contained food and essential items, canned spam. There was bread that had a life date of 18 months, various bits and pieces, some very dodgy things and some very good things. Apparently everyone loved the fig rolls that were in those boxes. But many people didn't want those boxes and hadn't realised when they ticked yes to help with food that it actually meant they were going to have a weekly box, which they really, really struggled to be able to cancel. So they started contacting the helpline saying, I've got this box, I don't want it, I don't need it, what can you do about it? So volunteers would then go around and collect up those boxes, take them to one of our community centres where they would be sorted through, and goods that could be reused were then redistributed back to community food settings such as the food banks and the community bridges. And then a crisis always happens on a Friday at 4 o'clock, just as things are winding down. So working with CAN, we established a core group of emergency response volunteers that we could call on when that crisis happened on the Friday afternoon or evening, to be able to go and do that emergency shop for someone who didn't have any other support or means of accessing it. So a lot of work took place there. And these are just some of the quotes that Community Action Network collected from their volunteers, from the feedback that we had through to the helpline about how valued those volunteers were by those people who were receiving that support. So just take a minute to read through some of those. And I think it's really important to note that at the start, a lot of this was about volunteering to support someone because it felt like the right thing to do. But as we moved onwards, through 3 lockdowns, many volunteers developed real long-term friendships with the person they were supporting, and it was no longer about volunteering tasks, but it was about how can I support my friends to access the support they need. And literally just today we've had another email come in saying I've been supporting, and we always call our lady in need Mrs. Miggins. I've been supporting Mrs. Miggins for the last 2 years, but I think now I need to move on and do other things. She still needs support. Would you be able to mix her up with someone? So you can see that people really, really cared about those relationships that they formed with the people they were supporting. So what was the impact on the pandemic on engagement as a whole? Well, there were some real positives. There was no rule book about what you do in a pandemic. The government were very good about sending that to us probably 2 months after we'd started doing something already. So we had to develop our own ways of working, be far more collaborative. Particularly of note is we threw away the red tape that stopped us from making rapid decisions. So councils like to have a lot of red tape about making decisions going through committees, cabinets until we come to a decision. And quite rightly too, because the decisions that we're making are often very, very serious and important. But when you're responding to an event like this, you've just got to get on and do what's needed to be done. So that was really, really enabling for us to be able to just say, OK, well, look, we've got an issue here around X, Y and Z. We just need to solve it. Who do we get around the table to be able to fix that problem? And we enabled ways of letting trusted voices lead on communication and engagement. Again, it's not necessarily the council who are best placed to do that messaging. So when we are working with NHS and CAN around vaccinations, there was a real need to look at how we engage with the Muslim community to make sure that they were aware of the need to get vaccinated, because there was a lot of myths going around at the time that there was pork within the vaccine, and as Muslims obviously they would not be able to have anything with pork in it. So it was looking at who were those trusted voices and working with Imam Yassin at the Bournemouth Mosque to have him be the person that gave that messaging out to our local community, because the Muslim community listened to him more than they would listen to us as a council. So real learning there about who are trusted voices and how can we use that to communicate and engage with our communities. And again, we're stronger together. It's not rocket science, but by working together for a common aim, we can all do so much more. And as councils, we love to be in control, but the real learning here was that we recognise that we're not best placed to do everything. The community and voluntary sector are a specialism in so many different areas, and actually we just need to enable them to get on and do what it is that they can do best. So another example of this would be as shielding as we were coming out of lockdown, the government decided, right, we're not going to do the Boris boxes anymore. That's going to be your responsibility, council. You need to provide them, and then we'll pay you to do that. It was very easy to do what the government had done and simply go to those food providers like Breaks and say, OK, can you deliver 2,000 food parcels to these addresses for me, please? And we'll pay you. And instantly that would have cost sort of between £40 and £50 per box per person per week. We didn't want to do that. We recognised that the people who are best placed to provide that service were the local community and voluntary sectors. So we worked with our community food settings, our food banks, to devise a food box scheme that we could have delivered by volunteers to those residents that still needed it, in terms of those shielded residents. The cost was less than a tenth of the cost that we would have paid if we'd gone with the national providers. And equally, we were able to tailor those food boxes so that they met the individual needs of that particular person or that family. So if they had a food intolerance, if they were vegetarian, if they were vegan, we were able to work with that community food setting to make sure that that food parcel was appropriate for that individual. So just some quick examples of what we did as well. We were really concerned about the heavy reliance on digital web pages, Facebook and things like that for provision of information. So obviously, yes, the vast majority of people are on the internet and can access Facebook and all of those different locations. but there are also a lot of people who are not. And we were really concerned that those people may be the ones who needed our help more than other, because they weren't connected, they weren't able to get out and about and access information in the usual means. And people who are digitally isolated may actually be even more isolated as a result of the pandemic. So these next few slides are a couple of examples of the work that we did through Together We Can partnership, working with our partners to try and address some of those issues. So the first one is a fantastic project run by Community Action Network. This is the Yours Sincerely project. And again, it's not rocket science. This was, and it still operates, a cross-generational pen pal project looking at tackling digital exclusion. So it simply is a group of young school children who write to elderly isolated people, sending them a letter, just like we used to do when I was a child, in terms of a pen pal scheme, just to try and give them something to look forward to. Second one was a project that was set up with Prama, and there were a wide range of organisations like Red Cross, Rotary were involved in this project. We really recognised that there was a cohort of our residents that usually would have gone to things like lunch clubs or social settings, day centres, who no longer could do so. And the initial reason why they would have gone to those settings is because they didn't have a network. They were already isolated and suffering. So how could we reach out to them and make sure that they were getting the support that we needed? So again, linking out to those trusted voices, those community champions, who were the individuals that were hosting those clubs initially. So we contacted them and said, you know, can you reach out to your clients as such, your residents, and find out if they need support. And what we established, there was a real need excuse me, a real need for a way for people to engage, particularly those people who didn't have the internet. So we found a bit of kit and we worked together, and we got a little bit of squirrel money, and we set up a telephone friendship group. And in essence, this is a bit like a coffee morning, but you use it on your landline. So you dial a number, and up to 10 of you can be on that phone call at the same time, with a supervisor overseeing, your volunteer supervisor, and you can just have a coffee and conversation chat with people to try and reduce loneliness and isolation. And the calls were themed, so you could have had a gardening world call, or they were individuals just having a chat and just trying to raise each other's spirits during this difficult time. And what else did we do to try and address that social isolation? Well, councils have a lot of information at their disposal, but sometimes we don't make the best use of it. So at the start of the lockdown, we used our council records to identify around 11,000 residents who were aged over 70 that we knew were living on their own, because the council tax records that we held identified that they received a discount for that. So again, thinking about digital exclusion, there's no point trying to email them, even if we have got their email addresses. We sent postcards to every single one of those addresses with details of the phone number for Together We Can, so that people could contact the helpline, ring through to us if they needed help at any time. And again, although we were in lockdown, we were encouraged to go out and take a daily walk. So we were thinking about where are the places that people already go to that we can put information. So we distributed posters to every GP surgery and pharmacy across BCP. And also, if you've been past one of the bus shelters that has one of those digital displays in it, we were contacted by the company that sponsors, that advertises those things, and they said, look, no one's advertising because no one's out and about, can you use these? So we were able to get the details of the Together We Can helpline, the contact number, onto those digital displays, so that key workers who were using the bus to get to work, or people who were out and about taking that daily walk, the daily constitution, were also able to see the information and make use of it should they need to. And absolutely key, as I've already touched on, is around using those trusted voices and the community champions to engage with individuals, because people resonate with messages that are given to them by people they associate themselves. So I've already talked about Imam Yassin for Bournemouth Mosque and his engagement with the Muslim community. It's using that approach. Who are the people best placed to deliver the message that we need to get across about the support that's available? So what's next? Well, we don't want to go back to where we were 2 years ago. The incredible community resilience response and that neighbourliness that we've seen as a result of the pandemic, we want to capture that, we want to build on it, we want to grow it. So we have recently approved our voluntary and community sector and volunteering strategy. That was approved in October 2021, which looks at just that. How do we capture that? How do we grow that? And how do we enable more of that wonderful stuff to take place? And as a result of that, we're developing and transforming the council and looking at how we embed communities and the partnerships right at the heart of everything we do. How can we encourage other service units to work much more collaboratively, to co-design and work with our communities and engage with them far better? And working with our emergency planning team, we're looking at developing a specific function around community resilience. So when we have, as we've talked about, flood events, or when we had Storm Eunice and we had residents in the Herne area who had no electricity for 4 days, about how we get out there, we do the door knocking, and what is our response, making sure that we've got the food provision that enables them to be able to eat during that crisis. All of those sort of things that pop up every now and then, and now I'm realising they pop up almost every 2 weeks, something seems to be popping up, looking at how we have a service that can respond to that above and beyond what's the emergency response, but about the next bit, about how we look after our individuals, or as I often refer to it, is how would I want my mum to be treated if she was in this situation? So if there's been a fire and someone's been moved out of their accommodation because it's no longer livable, yes, we've got them accommodation, we've got them food, but how do we add that extra bit around them and treat them like human beings? And above everything, it's about learning from COVID. Let's not go back to the way that we did before. We've really raised the profile of the community and voluntary sector across BCP, and I know across Dorset as well. I don't want to go back to that situation where we are thinking of ourselves as a council that is always in control of everything. So really about how much stronger we are together as a partnership. And as my voice is starting to go, that's very good timing to say that's the end of my presentation. Are there any questions, please?